أهلا وسهلا. Hoş geldiniz.
Bienvenidos.
Selamat datang.
Welcome to Speaking Our Mind podcast, where health is more than healthcare. Welcome to Speaking Our Minds podcast, where health is more than healthcare. My name is Iraida Muñoz, and I am the Public Health Strategist with the Division of Public Health and Community Services here in Nashua, New Hampshire. And I'm here with Savitri Horrigan, Public Health Behavioral Health Strategist.
Yeah.
Welcome, bienvenida.
Thank you. Selamat pagi. Good morning, everybody.
Good morning. And also we have here Jonathan Gonzalez from Flow Free or Die.
Good morning.
Bienvenido.
Gracias.
So we are here for our second episode of our third season of our new podcast. And we have a great subject that we're going to start discussing. And we just came up with a new slogan that is called Where Health is More Than Healthcare. And I was just explaining, and you were just asking, and I said, I want to explain it, and I just want to be human in front of our audience.
Yeah.
And you were just asking, are you comfortable with it? And I said, yes, but I want to explain why. I want the audience to understand what I have in my mind because I really want to speak my mind about it. This is all what is it about.
Totally.
Speaking our minds, right? This is why we are doing this podcast. When we speak about health and healthcare, we all think it's about our physical health. But when we are also thinking about health, we should include our mental health, our emotional health, our whole spirit. There's something I want you to know about me as a person. I am also a very spiritual person and a very emotional person. So for me to transition to a new space, including our spiritual and our other parts of health, includes a lot more than our physical health. I believe we are a whole, right? So in order for all to accomplish a whole person, a whole health, we just have to understand that health is more than healthcare.
Yeah, you have to look at it holistically. It's like it doesn't make sense to separate all of these different parts of our identities when it all impacts the whole person.
So when we are working in prevention, we are working with our own whole person, right? We have to understand that we have our minds. We have to work with our whole person, physically, mentally, spiritually. We have to be sure that we are working our best. We have to be sure that we are eating well, we're sleeping well. We have to be sure that we have good relationships, good connections. We're working with prevention. We are connecting with the right people. We are living our best life in our best neighborhoods. We are accomplishing what we can do in order to accomplish what we can accomplish and beyond for our own and for our families, our kids, our friends, etc. So that's why I had to pause and write our slogan and understand, because if I write it, I understand it, I digest it, I feel it, and I can transmit it to the audience. So that is the explanation of the slogan, Savitri.
Yeah, thank you. I mean, I appreciate that because it brings that personal, like human aspect to it.
So with that being said, I want to transition to our new subject that I think it totally relates to what you wanted to explain us today. So tell us what you want to talk about today.
Yeah, so for today, I wanted to talk about adverse childhood experiences and youth mental health and substance use and preventing that. And just kind of, have a conversation about like the what and the why of adverse childhood experiences and what, people can take away from that. And just kind of building off of this amazing panel that we had at the legislative breakfast last week. I'm still really grateful and in awe of all the experts that were in the room that were sharing amazing information.
I know it was such a great experience. For those of you that didn't have the opportunity to be with us in the room, there is going to be a recording coming up this week, and I'm going to be sure that we can link it to this episode so you can get access to it. Once it's ready, it's going to be ready very soon. I'm sure that Jonathan Gonzalez is going to be able to add it.
I will be able to add it and make sure everybody can access it for sure.
So we had part of the panel was Dr. Leah Elliott was there explaining amazing points of view about ACEs or adverse childhood experiences. Who else was there as part of the panel? Savitri?
We had Corinne Shea from One Choice Prevention, which has a lot of amazing resources in multiple languages on preventing youth substance use. And then we also had Caitlin Kearney, who does a lot of trainings on the ACERT program. And I do not remember what that acronym stands for, but I think it's, I believe it's ACE's response team, usually embedded within local police departments.
And the moderator, let's not forget.
Yes, Mike Athelberg from the United Way of Greater Nashua. So grateful for Mike and the panelists for, just having a really awesome discussion.
He did an amazing job with all those final questions. And
he knocked it out of the
he
park.
made it. Because they were so many questions in the end, and he was able to accomplish the assignment.
Yeah, absolutely. He did an incredible job. He made it personal. It's a tough topic, and I feel like he brought a really good vibe, for lack of a better word, to the panel that just made it, educational, and also accessible, and making sure that people are sharing a good amount of both data and stories to really drive that impact home.
And that's why I love collaborations here in Nashua, New Hampshire. So thank you, Mike, for your collaboration here in our legislative breakfast. So I can't wait. Let's just start with our conversation about ACEs.
Sure. So adverse childhood experiences, I'll start with the what. What are these? They're serious childhood traumas that can result in toxic stress. Prolonged exposure to ACEs can create toxic stress, which can damage the developing brain and body of children and affect the overall health. And this is something that we measure traumatic events that happen between birth and the age of 17. And so just some quick facts about the impact of ACEs. It can increase the risk of diseases like liver disease, heart disease, sexually transmitted disease, depression, asthma, as well as things like alcohol use disorder. So,
and let me just interrupt you right there, because
Sure.
I know that you say between birth and what ages of
birth and 17.
Yeah, I do know that there's also studies that are suggesting or saying that there is
One that I really like is kind of like a tree example where you can look at the adverse community environments, which are the roots of these issues. So that includes poverty, discrimination, poor housing quality and affordability, community violence, lack of opportunity, and economic mobility.
Mhm.
And these are the roots of the adverse community environments that can influence the mental health challenges, incarceration, homelessness, domestic violence, substance misuse, emotional and sexual abuse, physical and emotional neglect, all of these things that are, have so many complicated factors at play and when we talk about this too, I really do want to drive home that ACEs do not write your future. Our brains are plastic. The sooner that we can identify these ACEs in people and young people, especially, the quicker we can connect them to resources in the community and support systems to address these issues and help build those resilience and protective factors. But I want to drive home that it's not writing your future in stone.
Right.
Yeah.
And there's so many things we can do to prevent those ACEs or to work on those traumas once they happen.
Yeah.
And I, while you were speaking, because part of the previous job I had as an equity officer was looking into those circumstances that were different for folks more exposed. I remember that you went to one of those trainings in Manchester and you were telling me all about how Black women were more exposed to those traumas in previous generations. Do you remember that train that you went to Manchester?
The high rates of maternal mortality for Black women. Yeah. And that has so many different factors. Black women experience much higher rates of maternal mortality, and that can be due to the treatment that they receive in the hospital before, during, and after a birth. Maybe not getting the same type of treatment as other demographics when they're getting their screening tests, not having proper pain management, not being believed when they are experiencing pain and need additional care and support. Yeah, there's just so many things. And And there's also this broader context, like you were alluding to before, you know, that environment of racism, a systemic racism that just impacts things in so many different ways. Like, for example, what is the training that a provider has, a healthcare provider has in making sure that they have a health equity lens when working with Black women and Black people who can be pregnant? Are they aware of these systemic inequalities, and are they able to address that and really meet the patient where they're at and give them the care that they deserve?
Yeah, the right medication. And there's so much data to share that sustain what you're saying, Savitri. We know this.
Yeah.
It has been in our system. Systematic racism has been in existence for so long, unfortunately.
It also reminds me of the treatment of like women in Puerto Rico with like, you know, inhuman testing of like birth control methods on women in Puerto Rico and how that has impacted people over generations. And there's a whole like history of reproductive oppression and coercion that is really important for people to know about, because it's just, it really helps, I think, people to understand and have that trauma-informed lens, so that they're not just looking at somebody and being like, why are you so like distrustful of this medical situation? Why are you upset right now? And it's like, it makes so much sense why people would mistrust a situation if they've had that historical background, or if they know loved ones or like mothers or grandmothers that experienced it.
Right. And we are going to have an episode in Spanish as well, so folks can understand. Because sometimes people that experience these traumas are not realizing all these feelings just because they are feeling the feeling and they were never explained why they feel that way. So I'm going to be sure that they understand all this information in their own maternal language. And for folks in English, we are going to do an episode in systemic racism in English as well, so they get all this information.
I think that's one really important, because people, they deserve to have their, you know, have that validation and be listened to.
Absolutely. Thank you.
So I did want to share some kind of just quick facts about why adverse childhood experiences and understanding them is so important. Individuals who have an ACEs score of, and when I say score, I mean there's like a questionnaire that people can take. One of them is it has 10 questions, and you just check the boxes on them.
And this is a questionnaire that I have in my hand right now that you can access this information in. This is
from the ACEs Aware.
A 10 question that is called, it's an adverse childhood experience questionnaire for adults, part of ACEs Aware Screen, Treat, Heal, from California Surgeon General's Clinical Advisory Committee that I am reading right now. And it offers an instructions. This is a 10 category of adverse childhood experiences. So I'm just going to read the first one so people can understand more or less how it looks like. Did you feel that you didn't have enough to eat, had to wear a dirty clothes, or had no one to protect or take care of you? That's the first question.
Yeah, and they have other ones too, like, did a parent or adult in your home ever swear at you, insult you, or put you down? Did you feel that no one in your family loved you or thought you were special? There's a whole bunch of questions, and these are very, sensitive topics that can bring up a lot of feelings for folks. So,
did you live with anyone who went to jail or prison? Did you lose a parent through divorce, abandonment, death, or other reason? So these are very sensitive questions. For some folks that are listening to us right now, it brings just memories, right? And maybe hesitations, whether or not should I check yes or no. And it puts you into, okay, do I really want to say yes or no?
Yeah, right.
Because it really brings you memories. And this is why this questionnaire exists.
It can bring up stigma too, like that if I check yes for this, that's acknowledging that you were harmed in some way.
Yeah.
I just want to chime in. It can also bring fear of consequences too.
Yeah.
If they do answer truthful, what's going to happen with their family member, or what's going to happen with the person they're referring to, right? And as whoever they are, if they're a child, loved one, whoever, a lot of times they don't want, because even though they go through what they're going through with that person, they don't want them to,
Right.
something to happen to them, whether it's being taken to, somewhere or jail or whatever. So it's very, like you guys mentioned, sensitive. At the same time, I think we encourage everybody to answer as truthful and honestly as possible.
Yeah, and that's why it's so important to do it anonymously and make sure that you're doing this with a professional mental health professional, because you want to make sure that you're talking to someone who has that client confidentiality. You can lower that stress or anxiety that it's going to impact, because oftentimes people are juggling both feelings of love and those complicated feelings of, oh yeah, I was hurt by this person that I loved and who loved me. But that's why it's so important to talk to a mental health professional. And I would be remiss to not mention, one of our great resources here in Greater Nashua, which is the Greater Nashua Mental Health Center, where you can get access to care if you're looking for somebody to talk to about this. And then we also have an incredible resource for the state, 988, which is our rapid response hotline for mental health services.
And if you don't know how to find all these resources, or if you forget these names, you can always call 211 and find them anytime from any phone. But coming back to the subject, if you got stuck in one of these questions because they were too hard to digest for you and you're listening to us, the real reason why we want you to understand this is important is because we want you to really overcome and actually achieve health, because health is more than healthcare. As we were saying, if you don't know why you should do this, sometimes we just need to move on, right? Well, not sometimes, always we need to move on with our lives to achieve health, because we all deserve health. We all deserve to achieve health for better, right? To be better. And if you're concerned or if you don't know what is going to happen with your data, if you're concerned and if you have questions about what's going to happen with your privacy and data, please ask your questions to your PCP, to your providers, because all this information is very confidential and it doesn't go anywhere. This is all protected, right? So and it's for your health. So that should be established.
I just wanted to kind of wrap up by saying that it's really critical to understand and look at ACEs data. Just briefly, people who have an ACEs score of 5 or higher are 7 to 10 times more likely to use illegal drugs and develop a substance use disorder. Wow. An ACE score of 4 increases attempted suicide by 1,200%.
That's why it's so important to do this.
Yes, 100%. And so, but also at the same time, just reiterating, our brains are plastic, our bodies want to heal. And we can use this information to build resilient families. We can educate ourselves, parents, caregivers, about their own ACEs to help them understand, what's going on in their lives and help them have resources for healing, become healthy parents, so that we can all work on preventing passing on ACEs to future generations.
I think that's the key, right? Passing these traumas are not cool. We really have to stop those traumas right now. Any final thoughts? I know these are super, super important conversations, Jonathan. And
yeah, absolutely. I think that this is a resource that, if I'm being honest, we didn't have back in the day. So I think that, for those that think that they need it, and if they're doubting themselves that they don't want to do it, but they still thinking about it, take the test, take the questions, use your resources. It's here to, for the better. It's not here to make you worse. At the end of the day, that's what it's for. It's a good cause.
Thank you, Savitri, for all this information.
Yeah, terima kasih banyak. Thank you very much.
Okay, thank you everybody for listening, and until the next time, I'll see you again.
Gracias.
I'll hear to you later.
أهلا وسهلا. Hoş geldiniz.
Bienvenidos.
Selamat datang.
Welcome to Speaking Our Mind podcast, where health is more than healthcare.